Currently, there are several FDA-approved targeted therapies for EGFR mutation-positive non-small cell lung cancer patients. These include erlotinib, gefitinib, afatinib, dacomitinib now, and osimertinib. We have seen a lot of exciting data over the past couple years presented with regards to these agents. Most excitingly, we saw the results of the FLORA study last year and the FDA approval that resulted from the study. FLORA study was a large phase 3 study in which patients were randomized to receive either osimertinib or gefitinib and erlotinib. There was a significant improvement in progression-free survival for patients who received osimertinib. Overall, the therapy was well tolerated as well in the study. We're still waiting on the overall survival data, but overall the study was practice-changing and led to the FDA approval of osimertinib. Clinically, we see that as well that there are lower rates of significant rash with this therapy, and it's overall relatively well tolerated for many patients. We've seen recent FDA approval and data presented with regards to dacomitinib, which did have higher rates of diarrhea and rash, grade 3/4 toxicity compared with gefitinib. But there was an improvement in overall in progression-free survival as well as overall survival with that therapy. I think most people currently feel that osimertinib, based on its tolerability and overall and its progression-free survival results, remains a preferred frontline therapy at this point. But there are multiple options.